Joining me now is Dr. Robert Leverance with UT Health San Antonio. We're talking about over 1 million COVID-19 cases in Texas alone, over 1 million deaths globally. We need a vaccine. So many people are saying that that could turn the tide in terms of us getting back to something that looks more like normal. Can you talk a bit about what that would look like from the physician's perspective?
Boy, Dr. Cross, I couldn't agree with you more that after 9 months of this pandemic, we're finally seeing some glimmer of hope that it will come to an end with these vaccines. So although the data that we've been shown is preliminary, it seems exceedingly positive, better than we thought the efficacy.
You know, we have thousands of physicians and healthcare providers across Texas, but not all of them will be able to administer the COVID-19 vaccine. Can you talk a bit about the process in terms of signing up with the State Department of Health Services and becoming a provider?
We here at UT Health registered all 6 of our primary care clinics individually. So, it is a registration process, although it's all on the web. It was easy to access. The response rates from the state were quite prompt within a matter of days. And so the registration process itself shouldn't be a barrier for most physicians. I would be surprised.
Is there any additional training that physicians would have to go through to be able to administer this vaccine?
The CDC will give their recommendations for who should and who shouldn't receive this shot. So, of course, physicians and providers are going to need to be knowledgeable of what those recommendations are. But aside from that, no. A well-trained medical healthcare professional should be able to administer this shot just as they would a flu shot.
Talk a bit about the registry. Is there a registry? As you mentioned, it is a 2-part process. 3 weeks later, that patient would have to come back in and get that second dose. How do we track those individuals?
Yeah, fortunately, the pediatric world here in the state of Texas has solved that problem for us already. They already have a detailed online registry. So for any provider that already administers childhood immunizations, they should already be plugged into this statewide registry, and that same registry is being utilized for the COVID vaccine for both doses.
In San Antonio, like all across Texas, we have our urban areas, we have our rural areas, we have folks who are insured, uninsured, folks who are near a clinic and go often, folks who just don't. How will you handle outliers and other factors?
As usual, rural counties will have more logistical barriers to overcome than urban counties for sure, particularly with this vaccine, which requires, ultra cold storage, which can require, transport on dry ice. But this is all moving very quickly, as you know, Dr. Cross, and these very problems and challenges are being grappled with as we speak right now. So we don't have the answers at the moment, but within the next 2 weeks we will, because our first shipments we hope to receive within the next couple of weeks, which is absolutely marvelous. And we need to be prepared, and so we're doing that right now.
You have some groups, some minority groups, who are hesitant about getting a vaccine because of medical mistrust. How do you contend with that?
I guess our message to them is this, and that the great effort towards these vaccines has not only been towards the efficacy, but the safety as well. It's a much simpler immunization. It's not a virus, it's not a protein, it's a simple mRNA. And so we would expect that the tolerance would be actually quite a bit better. The exciting thing about this vaccine, even though it's new technology, we feel the tolerability will actually be better than most other vaccines.